Hello, all. It's your girl, Crystal, the creator and host of Pages. Welcome to an environment for us to express what's on our minds regarding random topics without judgment. So, without further ado, together, let's turn to page 4, titled DNA. DNA for me stands for depression and anxiety. It's important for all to know how these words are defined. Nowadays, in my opinion, DNA is used very loosely. To be clear, please allow me to define each of them. Depression. Depression is a common and serious medical illness that has a negative effect on how you feel, the way you think, and how you act. Anxiety. Anxiety is a feeling of worry, nervousness, or unease, typically about an foreseen event or something with an uncertain outcome. Now that we're all on the same page, let's dig a little deeper. Based on the ADAA, which stands for Anxiety and Depression Association of America, study shows 264 million people worldwide live with depression. Depression is the leading cause of disability in the United States among people ages 15 to 44. Around 39% of adults with major depressive episodes do not receive treatment. Now let's move on to anxiety. Again, based on the ADAA, anxiety disorders are the most common mental illness in the United States, affecting 40 million adults. That's 19.1% of the population ages 18 and older every year. Only 36.9% suffering from anxiety receives treatment. In addition, it's not uncommon for someone with anxiety disorder to also suffer from depression or vice versa. Nearly one half of those diagnosed with depression are also diagnosed with an anxiety disorder. I researched several different medical websites and they all align with each other. These statistics are very overwhelming. But then it's questioned why we have so many mass shootings and what can be done to prevent them. If you ask me, let's dig into why people of today's society are not getting assistance for their mental illness. There will be a discussion on gun violence in an upcoming podcast, so stay tuned. Back to DNA. Again, that's what I call depression and anxiety. I was diagnosed with depression and anxiety approximately 6 to 7 years ago. So I was around the age of 37 years young when I scheduled an appointment with my PCP, primary care provider, to see why my stomach felt as if it was full of butterflies. After being examined, my physician said I had signs of depression and anxiety. Now you're probably wondering how he came up with this conclusion. My exam consisted of blood work and a bunch of random questions. The questions were pertaining to my personal and professional lifestyle. Honestly, I did not agree with the depression diagnosis. However, I accepted the anxiety diagnosis. When he went into depth on the why he felt I had both, having anxiety made sense because of all those what I call butterflies in my stomach. Knowing he's the professional doctor and I'm the patient, I followed his instructions. For treatment, I was prescribed medication. Months went by and I did not feel any different, so he referred me to see a psychiatrist. OMG. Okay, that stands for, oh my goodness. I was not going to see a psychiatrist, not this girl. So I continued to take the medication as he subscribed and hoped that I would see a positive change. Instead, my mood was worsening, my appetite increasing, sleeping more, easily irritated, and them dang on butterflies was still living in my stomach. I knew something had to change and change fast. After researching psychiatrists and making sure my insurance would cover, I scheduled an appointment. I arrived for my appointment and noticed the environment was nice and comfortable and clean. So, first, I felt okay. As I sat down and we started to talk, we talked about my childhood, then moved on to my adult life, current events, and experiences. All good so far. Later was when the conversation got a little weird. So, how do I explain this without sounding like I went in without having an open mind? Because I really was open for whatever. But when the conversation switched to the reason why the psychiatrist thought I had DNA, I was like, really? I was told my DNA started with my childhood, that I needed to address my issues from back when before I would feel better. I crossed my eyes and said, I disagree. And then I asked, what did I say to make you feel this way? Let's call the psychiatrist Dr. Blue because I'm tired of saying psychiatrist. So Dr. Blue explained why and how the conclusion was made. And I still disagreed because what Dr. Blue was saying about me wasn't true. I promise I wasn't being closed-minded. It was almost like Dr. Blue created a series of false events and wanted me to agree that I felt the same when I clearly did not. I didn't have a bad childhood. I mean, it wasn't perfect, but it wasn't like Dr. Blue was making it out to be. When Dr. Blue pulled out a chair and asked if I saw someone sitting in the chair, I know then it was time for me to go. I didn't want to disrespect Dr. Blue, so I went along with what I called a charade. Payment was made, and I walked out very confused. Overall, I can confidently say that Dr. Blue's method was not for me. I definitely did not feel we were on the same page. But I didn't give up. Back to the website I went, searching for another doctor and verifying some insurance. I found another doctor and scheduled my appointment. I hit the jackpot, y'all. I finally found someone who was not living in the Twilight Zone. She did not agree totally with Dr. Blue's findings, and she provided her own perspective. She agreed I was suffering with DNA and broke it down to why. She was able to explain why the medication I was taking did not work. She wanted my treatment to consist of medication and frequent doctor visits. During our conversation, I finally agreed I was depressed. She had to break depression down for me in stages, which brought clarity. Leaving her office, I felt confident I was in good hands. It didn't take long for the medication to work. I felt so much better, even though I didn't even know I was feeling that bad. It amazed me how great I felt and how long I was walking around feeling as if everything was good when it wasn't. My treatment brought light to how I should feel every day. It's hard to explain in words because, again, I knew something was wrong, but depression never crossed my mind. Because of how society pictures DNA, I was like, that's not me. I was watching television one day and a commercial came on with a lady holding a fan that had a smiley face on it. She covered her face with the fan when she felt depressed so that people would not see her sadness. The commercial was representing a medication called Rexulti, Rexulti. and it's a medication used to help treat depression. Watching the commercial, my light bulb went off. I said, "That's me." Y'all, I could not believe that was me. Everything about that commercial was leaning towards how I was walking around in denial. I'm so glad I seek help, and I hope my story encourages someone to do the same. My ultimate goal was not to remain on medication. Eventually, I wanted my treatment to come to an end. This year, 2023, I decided it was time for me to come off my meds. I wanted to see how I could manage without them. So my doctor slowly started decreasing my dose. During this time, it's very important I show up for my counseling appointments because counseling teaches me coping mechanisms of how to handle good and bad situations. I'm not completely off yet, but I'm very close. Before starting this process, I had to accept it might not have the ending I'm looking for, meaning I might have to stay on medication. If that's my future, it doesn't mean I failed. It only means the test result shows I need the medication to stay healthy, and I'm okay with that. Now, let me be clear for those who think medication fixes all the problems. Let me be the first to say it does not. You still have to do your part in making sure your levels stay healthy. The world does not change just because you have a mental illness. You still need to know how to get through the bad and tough times. The medication helps you through the process, but there's work you have to do as well. When I have my not so good days, the medication and tools I put into play help me bounce back faster than if I wasn't on the medication. And I had no clue at one point in time what my part consisted of. I feel a lot of people think that the medication is a fix-all, and that's false interpretation. That's why it's highly suggested to participate in some kind of counseling when you have a mental illness. Everybody has mental health. The question is, how good is my mental health? I suggest you not self-diagnose and self-treat. Instead, go seek doctor, or should I say go seek a doctor. Have that conversation to determine where your mental health is before it's too late. Your overall mental health might not require medication. It could be you're only needing professional counseling or even just therapy. Everybody's treatment is not the same. As a tip, do your research or have someone do the research for you. With all due respect, it is not advised for you to see a life coach or a self coach. They are not equipped on knowing how the brain operates. They have their benefits. However, they are not medical professionals. Mental illness should be examined and treated by a medical professional, period. If you don't have insurance, reach out to different organizations, clinics, churches, friends, and family members. There's help out there waiting for you. You just have to go get it. Instead of picking up guns and shooting innocent individuals, or better yet, shooting yourself, go walk into a hospital and say, "There's something wrong with me." Or, "I feel as if I can do harm to myself or someone else." Or maybe, "Hey, I'm depressed and I need help." You will not be turned away. Don't walk around feeling sad or mad at the world. Go seek help because it's out there. It's so close you can now pick up a phone and dial a number that connects you to a hotline of experts that can assist you. I know some of you are saying, "Oh, it's not that easy." But it is. It's only hard if you make it hard. It's only difficult if you make it difficult. You have options. That's a good idea for a t-shirt. I think I'm going to make that happen. Okay, back to the topic. Be proactive and take advantage of those options. I mentioned friends and family, and let me also include the society. You are all equally responsible for making sure you check on your loved ones. You are not exempt. You do not have the right to look the other way when you know and see that there's someone in your presence that needs help. You may not have the means to help financially, but you also have options. Now, I know how sensitive this conversation can be, but in this day and time, we need to be transparent and get in front of the problem. I know some of you are saying everybody don't want help, and I agree 100%. All I'm asking is for you to do your part when it presents itself. For those of you that know you have a mental illness, all I'm asking is for you to do your part. Believe it or not, COVID-19 and all those other numbers that falls behind that word is not the only recent national epidemic. Let's add dysfunctional, untreated mental health to that list. Let's find a cure for that, no matter how it looks. Before I end, I want to provide the universal mental health crisis line information. By calling 988, you will be connected to a crisis counselor regardless of where you live in the United States. They can also be reached at 1-800-273-8255. And their website is www.suicidepreventionlife.org. Some additional resources are the crisis text line. Text the word REASON, REASON, to 741-741. It's free and they provide services in English and Spanish. You can reach the self-harm hotline at 1-800-366-8288. And lastly, the Suicide Prevention Awareness and Support can be reached at their website, www.suicide.org. Today, I encourage all my listeners to do your part. Because why? You have options. Please don't forget to subscribe, follow, like, share, download, and comment. You can also connect with me on Facebook, YouTube, Google, Apple, Spotify, and wherever you get your podcasts. Remember to embrace who you are and make every day a good mental health day. Peace out.